Hello, this is Kyung Hong. I'm going to have my presentation about prostate cancer. So let's look at my PowerPoint. Then what is a prostate cancer? Look at the picture first. This is a prostate gland. So the prostate cancer is a malignancy of the prostate gland. This is a very common cancer. So it grows so slowly that only 3% of men with the prostate cancer is the second leading cause of the cancer death in men. Then let's talk about the causes. Then the causes is not clear. So when some cells in prostate can become abnormal, then usually the man has a prostate cancer. The mutation in the abnormal cells, the DNA, cause the cells to grow and divide more rapidly than normal cells do. So those are the very common risk factors. The first one is age and the race, black men especially, the family history and obesity. Let's talk about signs and symptoms. The prostate cancer often does not cause any signs or symptoms in its early stages. And so the malignancy, the trouble urinating, decrease the force in the stream of the urine, blood in semen, discomfort in the pelvic area, bone pain, and erector dysfunctions are very common symptoms of prostate cancer. This is the prostate cancer, the tissues. I think this is very gross. Let's talk about diagnosis. Health history and physical exam is the first thing. In the prostate-specific antigen PSA test, which is measure the level of PSA in the blood. This is a tumor marker, so when the PSA level is higher than normal, it may mean that a man has a prostate cancer. The transrectal ultrasounds, TRUS, and biopsy, these tissues of cell from the body. The complete blood count, CBC, then blood chemistry test. This is help stage prostate cancer, include the bone and serum creatine, the calcium, and alkaline phosphatase. MRI, bone scan, and CT scan, then analysis the tumor histology, which is called the Gleason score, that leads to a scoring system based on the degree of a glandular differentiation and structural architecture. The Gleason score and the PSA, the level are incorporated into the TNM stage of determination as well. For the treatment, when deciding which treatment to offer the prostate cancer, these factors will be considered. Number one is the type and stage of the cancer and the grade of Gleason score, the possible side effects of a treatment, and your personal preferences, and your overall health, and your age and life expectancy. For the treatment of prostate cancer, the radical prostatectomy, this is most common use to treat prostate cancer. And transurethral resection of the prostate, this is the TURP. So this is TURP pictures. This is a help to relieve urinary problems. The cryosurgery, an experimental treatment for prostate cancer. The pelvic lymph node dissection, radiation therapy. This is also the common treatment for prostate cancer. The hormone therapy most often used to treat advanced prostate cancer or prostate cancer that comes back after other treatments. The chemotherapy, high intensity focused ultrasound. This is a high intensity focused ultrasound. Then corticosteroids, which is steroid hormones that act an anti-inflammatory by reducing swelling and lowering the body immune response. Then let's move on the survival rate. The outlook is good when diagnosis early. The early detection and treatment are key to a positive outcome. To prevent, quitting smoking and diet and exercise, then talk with your doctor regularly. This is key point for prevent prostate cancer. This is all for my presentation about prostate cancer. Thank you for listening.